Well, hello again. And this time I am very much looking forward to welcoming our second panel for this afternoon, which will delve into uh, digital inclusion and equality. So I will now welcome to the stage our CEO, Jonathan Chevalier, alongside three panelists for this very insightful presentation. Welcome.
Thanks, Lisa. Yes, glad to be back. For those of you who weren't able to join us for the opening session of the day, I'm Jonathan Chevalier and I'm the CEO of Charity Digital. I'm a white middle-aged male with slightly greying brown hair and a very short grey beard, and I'm wearing a blue checked shirt. Now, we've had some really wonderful sessions with brilliant speakers and panelists this morning, exploring accessibility and inclusion. And in this session, we'll be looking more at the impact of inclusion and exclusion on equality and what we as charities and other non-profits can do about it. For this session, I'm joined by a fantastic panel. We have Simone Curry. Simone is the policy coordinator for British Red Cross, and through her career, she's worked with many marginalised communities. And this work is continuing at Red Cross. Then we have Elizabeth Anderson, the CEO of the Digital Poverty Alliance, which is an organisation aiming to end digital poverty. And then we have Rachel Caldicott, Executive Director of Promising Trouble, which is a social enterprise focused on putting the community at the heart of technology and innovation. Their work focuses on equity and social justice. So I'm really excited about this session. I think we're going to get some really fantastic different perspectives from our speakers. To get us started, I'd like to ask a question to set the context overall. But I just want to flag up that this is intended to be an interactive session with lots of opportunities for you, the audience, to ask questions as well. So do that, please, using the Q&A button that's at the right-hand side of the screen. We also have closed captions for those who want them, and you just click the CC button on the session speaker screen to access that. Let's move into the first question. So this is about trying to get more of a sense of the impact of the digital world on equality today. And I'll start with you, Rachel. How have you seen inequality changed by the evolution of the digital world?
Hey everyone, I'm Rachel. So I'm a 50-year-old white woman with slightly orangey hair, large glasses, and a blue dress. And I think this is a really interesting question because in our work, we come at it from two different ways. So on the one hand, there are the ways that inequalities are caused by people not having access to the digital world. And there are the inequalities that are caused by technologies being rolled out and used in ways that are not just and fair. And they're two completely different things that have a bearing on people's lives in related and connected ways. So if I start by just spending a moment talking about the second half, a lot of the time, data that will be collected about us may be collected about us in ways we don't really know or understand, and decisions are made based on characteristics that we may have, or technologies may work or not work depending on those characteristics. So, for instance, a new kind of inequality that has been created by digital technologies is the use of facial recognition cameras to identify people who, for instance, in London at the moment, the Metropolitan Police are using those to identify people on the want list. However, we know that there are extremely high rates of failure with people with darker skin, younger people, women, and so that's an example of an inequality that has been exacerbated and deepened by the ways technologies are used. There are others that maybe the way the decisions are made about us, or the way that data are joined up. And then like the other half of that is there's a whole load of other things that happen when we can't be part of the digital world. So we've been doing a piece of work for the last 3 years, working with a community in the South London, understanding how they, how access to the digital world improves or otherwise changes their health and well-being. And one of the things that we've seen is that being digitally excluded is now, it's like a whole of life thing, right? And so it affects your ability to find work, education, talk to friends, be entertained, get access to health. And so I think there's a real tension here at the heart of what we're talking about, because everybody, I think, deserves access to the best things of the digital society, but equally, we all deserve to be treated fairly and with justice. And I think that is something that I think everyone here is probably grappling with.
That's brilliant, Rachel. Thanks for that. I feel it's started to open up the question really well. I want to broaden it now by asking Simone, how have you seen digital improving or worsening problems of inequality and marginalisation?
Thanks, Jonathan. Hopefully you can hear me all right. As Jonathan said, I'm Simone from the Red Cross. I am female, identify as she, her, wearing glasses. My hair is blondish brown, depending on the lighting, and I'm wearing a red and white striped shirt, which is in fact not intentional for the Red Cross colors, but here we are. And I also just wanted to start by kind of introducing the context for the British Red Cross connection to this topic, because often I think people can wonder, where does the Red Cross work fit into digital inclusion? So we are the largest independent provider of support for refugees and people seeking asylum in the UK. And so through our work with people that use our services and our operational expertise, we identified a real gap in the knowledge and the research of digital inclusion, of people seeking asylum and how this affects their access to healthcare. So that's kind of the perspective I'll be coming from today. And so we published a report on that called Offline and Isolated, which I can happily share with the group afterwards, that highlighted a lot of key findings of how digital exclusion inhibits this access. So Rachel introduced a key point that I can second, is that digital inclusion and the digitization of the world has opened up a lot of opportunities for a lot of people, but it's also closed doors for other cohorts of people. So it's a really interesting question to consider from the perspective of healthcare, because in fact, digital healthcare and access to healthcare online has opened up a lot of doors for people in terms of accessibility. So at the Red Cross, we run pilots on virtual wards, which is also known as hospital at home, so essentially receiving care virtually, which have the ability to mitigate certain factors that usually inhibit healthcare, so geographical location, access to transport, physical mobility, etc. And we know that living rurally and being older, amongst other factors, can have an impact on digital inclusion. And there have been a lot of great pieces of work and initiatives. A project from Good Things Foundation comes to mind that have done a brilliant job of identifying the communities that are being left behind due to the movement towards digital. But sorry, Jonathan, to preamble, but to answer your question, I was at NHS Confed Expo last week, and my impression of the current approach to digital healthcare is that digital inclusion is in fact top of mind, which is of course great to hear. However, a question that still remains unanswered is how healthcare commissioners are approaching digital inclusion for people who have never come into contact with the healthcare system before. So I think that's a really, albeit niche and potentially small cohort of people, but a really important component to consider. So if anyone in the audience has thoughts on this, that would be fantastic, because that's a pressure point I'm kind of grappling with at the moment. But as our report name alludes to, Offline and Isolated, this move to digitization has ostracized cohorts where in-person services were in fact the only way healthcare can be accessible in the first place. And so particularly with COVID-19, which accelerated the movement towards digital healthcare, a vast amount of people seeking asylum were left without access to healthcare services, and essentially in isolation from the rest of the world, without being able to contact their loved ones back home or feeling involved in social aspects of the digital world, which is largely how a lot of us, I think, socialized during COVID lockdowns. So yeah, because of these kind of ostracization and isolation, we saw a lot of this cohort suffering with deteriorating mental health and the inability to find access to healthcare, which led them to either delaying seeking help or relying on emergency services, which are obviously really concerning findings because it puts pressure on public services and also ultimately deteriorates the health of the individual.
Brilliant. Thank you, Simone. That's wonderful and great to kind of, I guess, broaden out our consideration of different aspects of inequality beyond just economic to also health inequalities, which are obviously massive for certain marginalized communities in particular. Let's move to Elizabeth now. So what issues are you seeing when it comes to digital technology and inequality?
Thank you, Jonathan. So I'm Elizabeth. I am a white woman with shoulder-length brown wavy hair, and I'm wearing a navy blue top with some little pale blue flowers that you probably can't actually see. But in terms of what we've really seen is there's been a rush to the digital world. So for a lot of us people actually like me, it's super convenient being able to do so many different things online. And for lots of organisations, whether they're public services, whether they're charities, whether they're private sector, that looks really convenient because it looks like, oh, all of this self-service that you can do, you can access anything you might need at any time of day. That all looks fantastic until you realise that there's millions of people across the country who just fundamentally can't do that. And this was something we started to see during the COVID pandemic. There was this feeling that we all had this shared experience, that everyone was kind of doing that same thing. We were all sitting at home, we were all working at home, using Teams or Zoom or whatever, and we were all watching Netflix, and it was all very similar for everybody. But we did some research with Deloitte last year, and we looked at data from all across all 4 of the home nations of the UK. There's 19 million adults who are in digital poverty. That's 1 in 7 people, and it's also 1 in 5 children. And this is something that often doesn't really get addressed. People tend to go, it's older people who don't engage with online, and that might be because they don't want to, or they don't have the skills, or they've never needed to. But there isn't necessarily that understanding that this is something really impacting families. So 1 in 5 children not able to access services like education, not able to do their homework when they get home because that's no longer something you can do pen and paper. You're expected to be jumping on the brand of choice, but we can all think of the big companies who'd be providing those classroom services. And schools do not have the budgets that they need to be able to provide devices with keyboards. So you've got kids who are trying to do GCSE or A-level coursework on a phone, often with a smashed screen, or shared with a sibling or anything else. And part of this inequality is the affordability side. So it's not just affording the device, it's affording the fact that the internet, it's not free. Actually, we're paying for our broadband, we're paying for our mobile data. Every time you go and look at a website, even if that's a support service, you are paying to access that because that's coming off your data allowance. And it's also thinking about some of those other aspects. So actually, is there the infrastructure where you live? So Rachel touched on sort of rural communities. We think a lot about rural and coastal communities, former industrial towns, where actually you might not have the infrastructure, you might not also have the support. So if it all goes wrong and you've got the blue screen of death, as everybody likes to call it, or your password doesn't work, or there's a failed update, if you don't have that techie person that you know or is in your house, or we'll all have it in mind, we know who we'd go to right now if this stopped working. If you don't have that person in your household or immediately in your network, where do you go when that breaks down? So we think about the support, we think about the affordability, we think about the infrastructure, and we also think about those skills. And what we are seeing, and it very much echoes what Rachel and Simone have said, is digital isn't an end, actually. Nobody wants to just use the internet. people want to use services. So we're seeing children who have worse educational outcomes than their peers because they can't be doing homework online, they can't be accessing content, they can't be accessing apps. We're seeing, as Simone has outlined, that healthcare divide. So some of the work we did with Deloitte last year showed 24,000 lives a year could be saved just for over 65s if we dealt with this digital poverty and this divide around health literacy, as well as the hospital at home sort of features that are coming in. And it links into employability, it links into accessing essential services. It's even starting to link into how people access entertainment, how they access cheaper bills, cheaper electricity, that poverty premium. So it really is a growing divide since we've seen this real push to just get everything online.
Brilliant. Thanks for that, Elizabeth. Yeah, I feel you really helped broaden it out even more there as well, particularly bringing in the educational considerations, which are huge, and how we don't, I guess, end up entrenching generations of poverty in effect as a result of this. So some real big issues, but as everybody has highlighted as well, some massive opportunities from technology if we can bridge those digital divides. I think it'd be interesting now to start trying to understand more about how charities and other non-profits can better understand the issues of digital technology and equality and how that's relating to their missions, how that relates directly to their beneficiaries. It'd be good to start with you, Elizabeth, on this and how you set about understanding these issues within the Digital Poverty Alliance.
Absolutely. So, of course, it's really important for any charity, us included, to live by what we talk about. And part of what we do is the research and the advocacy, but also a big part of what we do is helping real people who need real support. So that's whether they need laptops, connectivity, skills, other types of techie support. That's great, but how do people find out about that? And that's your absolute point one, because of course, a lot of the time when we want to tell, as a charity sector, when we want to tell somebody that they can access support, we think, right, we'll get a website, we'll put it on social media, we'll ask lots of people to amplify it and, write blogs and create video content. This is all fantastic. And of course, it does all get the message out. But actually, if you're trying to reach people who are on low incomes, perhaps they're arriving in the UK and they've not had that kind of access before, they're older people and they don't have that sort of engagement with social media, you're not talking to those people. You're talking to the people who are already digitally included, which for us is not what we're trying to do. So, one, have that awareness. Don't expect that everyone is going to be online. If you're trying to reach really different groups of people, point one, just be aware of that. Point two, for us, it is a bit of a return to doing it old school, not doing it digital. So actually thinking about how we can create collateral in different ways that can be multi-use. So it can be used online, but we can also either be creating printed copies or providing posters that other people can print out to just get that word through on those much more traditional sources. It's also thinking though about the services that we provide. So particularly a great example for us is we will provide laptops to people who have never had a laptop in their house before. They don't know how to turn it on. They certainly don't know how to set it up and set up email and all that kind of piece. We could signpost people to the unending supply of digital training that's out there, but that's not going to be helpful. What they need is actually step one, paper-based resources on how to turn that and how to get that online. And then two, yes, start moving people to digital support, but in a way that has been really created for people who don't have that techie knowledge, who don't know that those 3 lines in the corner are a menu. Because why would you if you've never been told that? So actually really thinking through who those service users are going to be, making sure anything we create absolutely has in mind, almost if you were making it for your nan, you wouldn't assume that she would know everything there was to know about where all the buttons would be. Keep it simple, and then work with some of the partners that we talk to a lot, people like IDEA, for example, who create really simple micro credentials, so really simple little badges. gamified, all quite fun, but really, really incredibly easy to use, and very much made with the user at the heart of what's trying to be achieved, rather than all the fun things that we could make it look and feel and do, but nobody's actually going to engage with if they've never been online before.
Excellent, thank you. Rachel, how would you say charities should be approaching this issue of understanding the impact of technologies on their beneficiaries?
And so I think that what's really important to think about is that every organisation will be different in terms of their capabilities, and then the needs of your beneficiaries are really the thing to begin with. So, you know, I have worked in digital for 30 years now. And one of the things I've seen is every now and again, there's a big rush to digitize everything, to transform everything. I think to Elizabeth's point, we have seen it's really important to understand the needs of your users and offer fallbacks to non-digital ways of working. But I think the most important thing that charities can do is listen and understand. So there are two different ways, I think, that beneficiaries are probably encountering the digital world. On the one hand, there's, you know, how people are encountering your services and where. We did a piece of work with Nominet last year that will be published in, I think, 2 weeks, that looks like how people under 25 are finding out about the world, right? And lots of them are much more likely to be taking recommendations from friends or influencers than necessarily typing a query into Google, right? And so think about the needs and affordances of who you're working with and reaching. But on the other hand, I think there's a really powerful thing that charities are able to do, which is listen to people and reflect their concerns. You know, it may be that someone has had a decision about them made by an automated service that is unfair and they don't know who to talk to. It may be they've experienced a fraud and they're embarrassed about it and they don't know how to raise it. And that actually, you know, the real power of charities is we're there to listen and respond. And I think it can be hard to know what to do with that information, but I think forums like this and groups like this are really powerful in order to then draw attention to policy makers and regulators. And so I think it can feel really overwhelming, but if you stick to your specialism and, you know, try to understand the digital world through that lens, I think it's really powerful.
Thank you. That's a really helpful way of looking at things. Simone, I'm really interested in how you've approached this challenge of the impact of technology on your beneficiaries at the Red Cross as well.
Yeah, absolutely. I think I'll probably amplify a bit of what Rachel said about listening, but I think the Red Cross asked ourselves this exact question really when we were considering our research project, which we did with the Health and Wellbeing Alliance. And this research really aimed to obviously improve our understanding of the experiences of digital exclusion and barriers to healthcare, but also to really meaningfully engage and collaborate with experts by experience to co-produce research tools, undertake the field work, analyze the data, and ultimately develop the solutions to kind of counteract the inhibitions to healthcare access online. And so that's a real core tenet of our work, was working with people with lived experience, not only in the research, but also in our advocacy work now. So as I mentioned, like Rachel said as well, about listening to people, I think that's one of the best ways to understand this issue, is actually to put the people that are living through these experiences and are seeing it firsthand at the core of your approach. So these are the people closest to the issue, therefore they're going to provide the best expertise that is otherwise quite difficult to obtain yourself in perhaps more traditional ways of research. And so in other pieces of research that we've conducted, we've also convened working groups of people with lived experiences who essentially lead the discussion and lead the research. And I think as a charity, that's probably quite a key part of the point that we can play, is that providing a platform for engagement can really open up a wealth of knowledge and increase to awareness and experiences of inequality when it comes to digital inclusion. And the second thing I will say about that as well is the findings that we've kind of come to understand from having the research led by people with lived experience has allowed us to extrapolate our findings to other inclusion health groups. So that includes people experiencing homelessness, those living with disabilities, etc. And so that has really facilitated cross-sector conversations and collaboration around increasing access to online healthcare services and also digital inclusion in general, because obviously we're working on breaking down barriers for people seeking asylum, but in fact this conversation, can be opened up to a whole load of cohorts that can benefit from the same kind of advocacy objectives being advocated for. So I guess to clarify that into two things is to seek out the insight and the knowledge and the understanding on issues that are I guess meaningfully led by people with lived experience. And the second is to play that convening role to facilitate conversation amongst partners and stakeholders, which ultimately prompts perspectives and thought and creativity, much like this Digital Inclusion Summit.
Brilliant. It's really helpful. So if a charity spends some time to understand in detail how digital technologies are impacting their beneficiaries, what solutions should they actually then be deploying to actually help them? How should they react to those issues that they're seeing and address the inequalities? And I'd like to start with you on this, Simone. How do you approach this in the Red Cross?
Yeah, absolutely. So obviously I've just kind of run through how we identified the gaps and kind of how that all came to light. And in terms of kind of approaching and advocating for the change that we want to see, we, as the Red Cross movement, obviously operate on a neutral basis at all times. But we found it really helpful, particularly in terms of these advocacy aims, to frame them in a very apolitical way. As you're more than aware, the world is kind of seemingly ever digitizing. But I think there is absolutely merit to increasing the discussion and visibility of digital inclusion on national and political scales, particularly because it's such a vast piece of work, and we need to see updates to a lot of the strategy in this area. But because we have quite I guess I'd say pragmatic and tangible aims that were identified from our research, we actually found it really beneficial to spend some time to map out the key decision makers, map out the key stakeholders, and really understand who we can speak to and go straight to the source of change. And we found that to be, I guess probably the more effective way of advocating for this. And so by doing so, we've been able to frame our calls to these kind of key decision makers that we've mapped out as relatively small amendments to policy and practice that can have an incredible effect on the marginalized populations that we're advocating for. So to kind of provide an example, one of our recommendations from our research was to have the application registration card for, so for those that don't know, that's the, it's a form of identification issued by the Home Office to people seeking asylum. And oftentimes it's the only form of identification people seeking asylum have when they do come to the UK. And so our recommendation was this card needs to be recognised as a valid form of identification for registration on the NHS app. Because if you don't have a passport or you don't have a driver's license, you essentially didn't have accessibility to the NHS app. So by we conducted a roundtable last year. We engaged with NHS Digital, who we kind of, as I said, mapped out and found to be the real kind of key stakeholder in this, on the basis of this recommendation. And they essentially added an additional source of identification. So they made the ARC card a valid form of ID. And I mean, to be honest, adding this additional source of ID was not a matter of national policy change, but has now opened up a massive door of accessibility for online healthcare for people seeking asylum. who otherwise wouldn't have had access without that valid form of ID.
Great, that's really helpful and great to have that very practical example as well. I'd like to move along, Elizabeth. So how have you approached this issue of actually addressing what you see as the inequalities caused by digital technology?
So I've talked a little bit about some of the really practical things that we've done around, you know, making sure that we retain those non-digital avenues. We don't make assumptions that everyone is online. I think also what's incredibly important is we know that across the country, only 1 in 5 people actually know what the term digital poverty means. And that's according to YouGov data. So people aren't familiar with the concept that you might be digitally excluded and that might be linked to affordability or a range of different reasons. So for one, we really want to raise the awareness. We want people to be talking about this. Sessions such as today, charities have made a great first step by coming along to a digital inclusion summit. It's a, you know, we're on the right road here. But talking to colleagues, and also the clue is in our name, Digital Poverty Alliance. We really do think that digital poverty will only be solved by lots of different actors coming together, whether that's the charity sector, whether it's government, national or local, whether it's business, big or small, whether it's education institutions, NHS trusts, and so on. The list is never ending. And really asking people to think about what they can do. Is it raising awareness? Is it making sure that actually the staff that you have within your own organisation, you know, charity begins at home, do those staff have the access that they need? Do they have the skills that they need? And do they also have the ability to be able to talk to, you know, the service users about their experiences of digital good and bad, and how to help and how to support, and how that links into what the charity does? It is partly just recognising we have had this move to digitisation. It's not going to stop. We're not going to go back, I suspect, to how we were before. So we have to stop as a society, and hopefully nobody on this call today would say digital is a luxury, but we have to stop perceiving more widely that, oh, digital is less important than other elements, and well, if you can afford a phone, you can't be doing that badly. No, that digital access is now absolutely fundamental, and that has to be seen as an essential service, a basic utility, and actually now just a sheer right. And very much within our work, again, sort of linking back to what Simone was talking about, there's a lot of advocacy that we're doing. We, again, as a charity, we approach everything very apolitically, so we're looking forward to whoever is going to be coming into government on the 5th of July after the election. But really how we can create a joined up government approach to this through actually thinking about how it impacts education, health, welfare, housing, etc., every area of life. And also we've recently created a charter for digital inclusion so that businesses and organisations can start to think about that in the same way. We, or at least I, liken it to 20-30 years ago. People saw climate action as something for big polluters. That was something that they needed to sort out. And now we see that as being something absolutely fundamental to every organisation, all of our own lives. There's no distinction made. Everybody can play a part. Digital inclusion, it's reaching that kind of level where it's so fundamental, it sits beneath other forms of poverty, and we need everybody to be taking action around that.
That's brilliant. And yeah, thanks for bringing to the fore that point about the charter, which I think is a fantastic idea as well. Rachel, I'm interested, because you work with a whole range of different organisations. I'm interested in how you'd say, in general, non-profits should approach these issues that they see.
So I think the first thing is it can be really difficult to read through the hype. So at the moment, lots of people are talking about AI. Lots of people feel they need to automate things, or that they're somehow behind if they aren't. You know, and I would really encourage everyone to only sort of use technologies in ways that are really genuinely benefiting your communities and your workers. Like, there's nothing to be gained by implementing technologies that are likely to put people at risk. And I think that is not to say you can't be innovative and try things out, but I think particularly within the charitable world and in public sector, we have a duty to innovate with care, you know. So I think that's one part of it. Another part of it is to actually, you know, it can be really difficult to explain to people how to notice the ways that technologies are rolling out. You know, it appears to happen slowly, and then all at once, right? And I would say that when you're out in the world and you're observing things, like when you're in the supermarket and you're suddenly having to use a self-checkout that is maybe difficult to get to, or hard for certain people to use, log all those things, notice them, take them back into your practice. Because I think a lot of the time we've been conditioned to think that research is something that has to be something that happens over years and years and years and be highly evidenced. But in a context where technologies are rolling out really fast and things are changing, I think there's a lot of validity in relying on your instinct there. And then just in terms of two really practical things, we have a couple of tools that may be useful. So one of them is a consequence scanning tool where you can start to think about and understand what's likely to happen if you use technologies in certain ways and how specific people are likely to be affected. So that kind of allows you to game through what you're doing. And another is to really think about and articulate your values and think about what those values turn into as behaviors, right? So if one of your values is to respect people's respect their privacy and dignity, I think really carefully about the way that you're collecting data about them and using it. And it may feel sometimes that you're pushing back on progress, but actually there's nothing worse than rolling out at haste, learning fast and rolling back, right? You know, better to be careful, particularly because none of us have loads of resource now.
Thanks. Yeah, some really good insights there as well. And can I ask a quick supplementary question? Because your consequence scanning tool sounds fascinating. How would people access that?
Oh, we can. It's Googleable, very Googleable, but we can share a link for that.
Okay, brilliant. That'd be helpful. So what I'd like to do now is move to some of the questions that have come in from the virtual floor. We've got quite a few in already, and if you've got any other questions, anybody, do please log those as well. And if you want to express a preference for a certain question, you can vote for that so it can move to the top of the list. And I'm going to start with the current top one. It's kind of a couple of questions combined, actually, so I'll have to try and break it apart. It's from Sophie. So the first part of it is, how would you propose marketing material to raise awareness of your charity to target those people who are not online? You mentioned print, but that could be very costly. What other approaches might people use? I don't know if anybody has a particular preference for taking that question. Go on then, Rachel.
So I think it's really important to think about designing a service. So rather than saying, let's just make a website and put it there, begin by designing in a way that the people who are going to find it hardest to use, that it's easier for them. So design with accessibility in mind at the beginning. That doesn't have to be on paper. It might be on the phone. It may be that there are other things that you're able to digitize that make capacity for more people to be available to help. But, I would say always begin with the needs of the most excluded people first, and then work in from there.
Thank you. Simone, I'm interested in your perspective here, because a lot of the asylum seekers who you're supporting in the Red Cross, I'm assuming they don't necessarily have online access. So how are you actually making them aware of how you can help them?
Yeah, it's a really interesting one, and I think hopefully this can be helpful for those that work with specific cohorts of people using their services. Because obviously when you think of non-digital, you do think of physical copies, but in fact we're finding and working with some partners and stakeholders that actually kind of taking some time to consider where some really key touch points in the community that these people access on a regular daily basis, that you can actually articulate your message that way and increase awareness that way. So for example, that could be a place of worship, it could be education, if they're dropping their children off at school. We're also doing our best to get information into asylum accommodation, which evidently would be a common place for people seeking asylum to frequent. And using that as kind of our I guess mapping exercise of how we can reach quite a vast number of people in a bit of an alternative way. And this can either be, I know you've said that physical copies are costly, but this can be through word of mouth. It can be through having a contact and a representative in these community points that can articulate the message. And also another learning, like I said, from NHS Expo in terms of access to healthcare is, in fact, we're seeing a lot of healthcare providers in communities that have large populations of people seeking asylum. We're actually seeing healthcare providers go into churches, for example, and offer their services there, or offer information on how to access their services in that way. So that's kind of how we've seen alternative methods used for increasing awareness.
Okay, brilliant. I'd like to now move to the second part of the question from Sophie, which overlaps with another question there. So I'll combine those together. So how would you suggest doing an accessibility analysis of a charity's current digital presence? So are there any tools or resources you'd recommend? And linked to that, how can you get a sense of the extent of digital exclusion among current and potential service users? Maybe go to Elizabeth on that one.
Yes, sure. So in terms of accessibility tools, there are lots of different tools, and I can share a link for the one that we use, which can help you to do an analysis of your own website. What I would say is all of these kind of accessibility tools, they are fantastic, and they will flag up, what are the most serious sort of major problems on your website, what are kind of minors, almost advisories in MOT kind of language, and what conversely is working really, really well. That can't replace actually getting genuine feedback from people around how they're finding that website, talking to them. It'll tell you whether structurally, for example, it's really easy for a screen reader to be able to use. It'll address things around sort of issues that people with visual impairment might be experiencing when they try and use the website. It won't tell you whether it's a really easy user journey, or whether you've used a lot of big flowery language that actually a lot of people don't understand. So it's really important to talk to people and understand how they're finding it, what that user journey looks like, what that user experience is. But I can certainly share one of the accessibility checking tools that we use. In terms of understanding digital exclusion within the communities that you serve, that can be really difficult to measure, or it can be really easy. So if you are serving a community that is a geographic community, We actually have overlaid the classification of internet usage, which is catchy, with the indices of multiple deprivation, which is equally catchy. We love how catchy data sets names are. But you can use these really as a bit of a proxy measure for if there's a high level of deprivation and there's a very low level of internet engagement, you can assume that there's a high level of digital poverty related most likely to affordability. That is one way of being able to measure it that way. But if you want to be able to understand a different community that's not purely geographic, it comes back to that talking to people and doing that sensitively in a way where you're understanding what do they have at home? Do they have access to a laptop? Do they have access to broadband? Are they using data? What do their own skills levels look like?
Excellent. Rachel, do you have any more to add to that as well in terms of measuring the accessibility of the site and the current status of users and potential users?
I mean, I would say that all good service design starts with research into the people who are using it. So really, I think to Elizabeth's point, if you can begin by doing qualitative interviews, do field work, go in as much as possible, put the team who are making a service in the shoes of the people who will be using it and begin there. And I think that would be second nature to us when we're not thinking about digital. This is a really established way of developing and designing digital services. And it can feel, I think, sometimes like it's expensive, but actually it's a lot it's a lot more affordable to get it right at the start than it is to have to change it later on.
Brilliant, thank you. So I'm going to move to another question now because we've got quite a few come in, so I want to try and get through as many as we can. This is a specific question for Elizabeth. So, does the Digital Poverty Alliance offer devices?
So there's never a simple answer. You can never say yes or no. So in certain areas, we run delivery projects where we can provide devices, particularly to families. So hopefully the team will be able to share a couple of links for our Tech for Families scheme and our Tech for Youth scheme. But if you visit digitalpovertyalliance.org, you'll find that if you're working with people in Ayrshire, West Cumbria, Staffordshire, Norfolk and Lincolnshire coasts, Neath, Talbot and Bridgend or Northern Ireland, I think I got them all, or in Northwest Leicestershire on our Tech for Youth programme, that's a way that people can formally apply and kind of be semi-guaranteed a device. Obviously there's waiting lists and all that kind of thing. We are also incredibly fortunate that a number of organisations will donate their old tech to us. So just because, you know, a Windows 10 device is no use anymore to a company, there's things that we can do to make sure that that does have all the latest security on it and is either Windows 11 or turned into a Chromebook or whatever else. And we take those and we do operate a sort of a process by which charities can get in touch and let us know if they need help. And then we will sometimes we'll be able to meet that demand. Not all of the time, because an awful lot of people, millions of people, are in digital poverty, and unfortunately we don't have millions of devices. But we do what we can, and also always really happy to talk to people about other signposting that we can provide if we are aware of other charities that are able to help them, and also some of those really low cost providers who can also share refurbished tech, which can be a cost effective way of doing it if you've got a little bit of budget.
Yeah, brilliant. It's great that you're able to provide devices in any context at all, but as you say, the demand is obviously going to outstrip what you can do in your organisation, hence this kind of need for a broader coalition across society really to tackle this issue. Let's move along. So a really important question from Caroline. So she's asking if any of the panelists had advice on how best to take digital accessibility as a topic to leadership teams and trustees So how to get the buy-in to take the action that's required. Be good to maybe start with Simone on this one.
I'm actually afraid I'm not going to be very much help on this one. In terms of our research project, it definitely, there was kind of a collective understanding, as I said, that we got I guess, inception of the research project came from our operational insights. So it's definitely kind of made its way throughout the entirety of our organization, rather than it kind of being something that we had to generate a bit of energy and excitement around. So I'm afraid that's not massively helpful for the answer, but I'm sure the other panelists have more insight on that.
Yeah, so what you're saying is you were in the fortunate position of kind of having the leadership from the top in order to tackle this issue, which I think we'd all recognise is the ideal solution.
Very much so, yeah.
Yeah, so I guess we'll go to the other panelists. Start with Rachel, maybe, to say how you actually get the leadership on board so they can provide what's needed.
I mean, I think the first thing is there's lots of great research out there. So those numbers really speak for themselves. When you start looking into the research, whether it's things that all of us have published or good things, there's really compelling evidence there. Begin there. I think as well, right, I quite often work with people whose leadership are pressuring them to do very innovative, whizzy things, and being accessible, using these first is regarded as being a bit dreary. And I think there's a lot of power in presenting those numbers. I know for sure that big business has no concern in presenting what are sometimes quite made up numbers about efficiency, right? And that actually be really confident, be advocates for your users, use the numbers that are already out there. And I think, think about things like the public sector equality duty, which I know doesn't entirely apply to charities, but the thing I always say is there's no point in innovating if it doesn't work for everyone. And I think as leaders in the charity sector, everyone ought to support that.
Yes, absolutely. Elizabeth, do you have any perspectives on how to build this buy-in from the leadership and trustees?
I mean, I would echo the numbers piece. I would also, I think everyone working in a charity is doing it because they want the best possible outcomes for the people that you're supporting. That's why we're all here. I would say the numbers are incredibly important, but also where they can be backed up with real stories and real examples. So actually really thinking about your own service users, what feedback have you had coming in from them? Have you found that people have, for want of a better word, complained or, raised issues about the website? If so, start digging into that, start seeing, is this an accessibility issue? It's also worth pointing to the fact that within Europe, there has been recent legislation around accessibility. That is great to see. Obviously, it doesn't affect us in the UK yet, but I say yet because actually we do know what tends to happen in Europe tends to make its way over here, even post-Brexit. And why don't we all get on the front foot? Why don't we accept this is something that's really important to our users? There's probably going to at some point be a compliance issue that comes along with this anyway. And particularly if you are planning changes to your website, if you are even kind of, it's a hint in the wind that, at some point there's going to be that redesign, start building that in now. Start considering that needs to be one of your essential requirements, is that it needs to be open and accessible to everyone. And if we think about that, if we think about things that are made accessible to everyone, it's not just useful for those who need the accessibility tools. Actually, it's easier for all of us. We all like a less cluttered website that's really easy to navigate. So let's just build that in right at the start and start having those conversations now, even if it's not going to be something that you're doing for 2 years. So your trustees, your leadership team are starting to get used to, oh yeah, that does sound like it's quite an important thing that we should be thinking about.
Yeah, absolutely. Got another question, which is very topical, very of the moment. So Chris is asking whether the panelists believe that the advent of AI poses more of a risk or a solution for digital inclusion. Rachel, would you like to start off on this one?
Yeah, I mean, I would say more of a risk, but I wouldn't want to be totally binary about that. So I think for me, the risk is not of the existential kind. It's about the datafication and digitization of more and more and more of life, and the fact that that will become the norm, and the fact that the decisions will be made about people based on data they're not able to control or change. And so it's almost not really, you know, I would rather think about it as what are the ingredients of a good digital society? How can the benefits of the technologies we have work for everyone, and how can the harms be minimized? And I think really that's as much the case with AI as it is with, you know, lots of other tech, whether it's voice recognition, whether it's rolling out things that only work in apps and they don't work on websites. So there's lots of things, and I think it's really important to think about the whole rather than one bit of the tech world.
Yeah, absolutely. Don't know if Elizabeth or Simone have anything to add to that one, or whether we should move along.
Yeah, just happy to jump in quickly and say, again, like Rachel has said, I wouldn't want to think of it in a binary way, because I don't think there can be a blanket statement applied to answer the question. But in terms of the cohort of people that we work with, and our research on the matter, a key kind of finding of our work was that there is a lot of distrust around the digital world and how data is stored and how it's kind of connected. So, I mean, particularly in our context, there's concern about how healthcare data is going to impact immigration status if there's any connection between those two things. But you could probably extrapolate connections of data to, you know, other cohorts of individuals. And I think, unfortunately, AI is only going to exacerbate that concern.
Yeah, absolutely. Okay, there's a question for you, Elizabeth, in particular, from Pauline, who's interested. You mentioned micro-credentials earlier on. Can you explain what they are?
I certainly can, because it is exactly that kind of flowery, jargony language that I referred to in the previous question. So a micro-credential is, if we think about how people might want to learn digital skills, a lot of people may not feel that they want to take an entire digital course. We know that there's things like the European Computer Driving License. You can take whole courses in Microsoft Word. A lot of people don't want to do that. They just want to know the bits that are helpful to them. So micro-credentials are basically the bits that would be useful, but where you can pick up some kind of certification or credential that shows that this is something you have learned a little bit about. So one of the partners that we work with really closely is called IDEA. I think it's idea.org.uk if anyone wants to check it out. And people can take these really short, really fun, gamified lessons, and that's really overstating it, because actually they are really quite fun, and they don't feel like lessons, where you can learn something as basic as maybe how you connect to Wi-Fi safely, or how you make a PowerPoint presentation, through to things that I should really take, like how cryptocurrency works and what blockchain is, and literally everything that would sit in between. I'm a big fan of them because, as I've said, very few people wake up going, I'm going to learn to use the internet today. But if you just want to pick away at little bits, gain some skills, and then be able to work towards badges that basically highlight the bits of knowledge that you're gaining, so you feel like you're making progress and you feel like you're really learning and it's all really applicable, and then you can evidence that. I'm a big fan of micro-credentials because it's much more digestible for people in really short chunks of time.
Brilliant. That's really helpful. And last question's a super quick one. Simone from STAM. Sam is interested in the work you've done on virtual wards and wanted to know whether there are any links where they can find out more information.
I'm so glad you asked. Yeah, we've just published kind of our best practice guide to virtual wards. Again, another Health and Wellbeing Alliance project, and we're also in the process of writing a policy brief based on that best practice guide. So I will, in the next 30 seconds, try and find these slides for you and put them in the chat. But if not, I can. Jonathan, is there a way of getting this to?
Yes.
Yeah.
Yeah.
Okay, fab.
Yeah.
Maybe we'll do
We
that
could
so I don't have
share
to
after
fumble
the event.
around.
Yeah.
Okay, grand. Thanks. But no, absolutely, I can connect you with that, and we can have a chat as well, and I can include my contact details if helpful.
Yeah, brilliant. Thank you very much. I'm afraid that's all we've actually got time for today for this session. It's been a really insightful panel drilling into these challenges of equality and digital technology. So I'd like to thank Rachel, Simone and Elizabeth for your time. You've provided fantastic insights. We're going to have a couple of minutes break now, and then we'll be back with our next session, which is presented by Prue Watson of the RNIB. She'll be covering how to make your social media accessible and inclusive to all. I'm sure it'll be a really fascinating session, so do come back in a few minutes.